Good, happy Tuesday evening, April 14, 2020. I'm Riley King, and welcome to this Tuesday evening edition of the Riley King Newscast, right here on the Riley King Network. We have a lot of news to get to this Tuesday evening, so let's begin. First up, for more deaths linked to COVID-19 outbreaks at long-term care facilities in New Hampshire. Sununu announces stipends program from frontline workers at long-term care facilities. As for more deaths linked to COVID-19 outbreaks at New Hampshire long-term care facilities were announced Tuesday, Governor Chris Sununu said frontline workers helping the state's most vulnerable will receive newly weekly stipends. Healthcare Commissioner Lori Shipperton said 3 of the people who died were residents of Hanover Hill Healthcare System, and 1 was a resident of the Huntington at Nashua. She said the people did not die recently, but the deaths were just confirmed to be related to COVID-19. Dr. Benjamin Chan, the state epidemiologist, said there have been 73 more cases of COVID-19 confirmed in New Hampshire, bringing the total to 1,091. He said about 30 of those cases came in a batch from tests done at the Massachusetts Public Laboratory. Sununu said starting as soon as Wednesday, frontline workers at Medicaid-funded long-term care facilities or in-home healthcare environments will be able to apply for 300 weekly stipends. The governor said those workers protect New Hampshire's most vulnerable individuals, and the state must strengthen its commitment to them. The Department of Employment Secretary will use general funds to pay for the stipends, with the expectation that the money will be backfilled by federal funds later, Sununu said. Sununu said the state is also partnering with Convent MD to expand testing for workers at long-term care facilities. Mobile testing sites will be set up near the facilities in Hillsborough and Rockingham counties with the goal of testing all 6,600 workers in those facilities. Sununu said about 70% of all positive cases in the state are in those 2 counties. The cost of the testing will be borne by the state, Sununu said. Chan said the number of people hospitalized for COVID-19 has stabilized about 70 people on any given day. There have been 163 people who have required hospitalizations in New Hampshire throughout the course of the pandemic. Chan said the hospitalization numbers will likely fluctuate, but it's a good sign that healthcare facilities have not experienced a surge that has stressed their resources, even though hospitalizations appear to have plastered. Chan also continued and contend adherence to social distancing and other precautionary measures must continue to prevent a wider outbreak. Chan said the pandemic is likely to last weeks, if not months, longer, so it's crucial that people stay home except for essential trips and continue practice good hygiene. He said anyone who needs to go out should wear a face covering to prevent the transmission of respiratory sections. And now let's take a look at your COVID-19 in New Hampshire, what you need to know. Let's take a look. And here's a look at that COVID-19 in New Hampshire, what you need to know. There are 1,091 number of people in New Hampshire who have tested positive for COVID-19. 586,377 number of people in the United States who have tested positive. 27 number of deaths from COVID-19 in New Hampshire. 163 number of people who have been hospitalized with COVID-19 in New Hampshire. And 23,649 number of deaths from COVID-19 in the United States. This map of New Hampshire shows cases of COVID-19 in towns and cities in New Hampshire. Salem, 50 plus cases of COVID-19. New cases each day in New Hampshire. In the purple, daily news positive COVID-19 cases. In the orange, new hospitalizations. And in the red are the deaths. And again, your common symptoms: fever, cough, and difficult breathing. How it spreads, and prevention tips. And be sure to stay with the Riley King Network for the latest of your COVID-19 information. Heavy rain triggers flooding along Pemigewasset River. River level expected to come down through afternoon. Let's take a listen to that video from WMUR News 9.
Burst out the door when it matters most. For more than a decade, he's been right there, everywhere. And when American jobs are on the line, he leads the charge. ABC's World News Tonight with David Muir is America's most watched newscast, and we thank you.
Eye on the incoming water as this Plymouth State parking lot quickly filled up.
Then the water doesn't have anywhere else, other place to go, so it's kind of coming under through the culverts.
Heavy rain and snowmelt led to rapidly rising water in the Pemigewasset River, as seen on this video recorded yesterday. The river crested overnight and rose to more than 2 feet above flood stage by early morning. The water causing a small hiccup in the morning commute in Plymouth, closing an I-93 off-ramp and shutting down the southbound lane on 175A. But marks on the local gas station show flooding around here is nothing new.
This is kind of a normal, low flooding.
This time, no businesses or university buildings appeared to be damaged. The Holderness fire chief says it's just a waiting game for the water to recede.
We're 8 hours behind when the high water hits in Woodstock. And it takes about 8 hours for it to get here, and then it takes about another 8 hours for it to start to go back down.
And at this point, it does appear the water is at that point where it is beginning to recede, but we're told that it still may be another couple of hours before it fully goes back down. We're live in Holderness this afternoon. Tyler Dumont, WMUR News 9.
Okay, and there you go on that video and that report. Live on News 9 at 5:30 p.m., unemployment official answers viewer questions. Richard Lavers, Deputy Commissioner of Employment Security in New Hampshire, will answer viewer questions at 5:30 p.m. this evening on WMUR News 9. Monadnock Hunger Walk switches to solitary event in era of social distancing. Walkers told to send donations directly to food pantries. Let's take a listen to that video from WMUR News 9, Ray Brewer.
We need a new generation of farmers, and these farmers need to be farmers who have taken care.
The need is now. Pantries, we're getting overwhelmed with a lot of people who needed something right away, people who were waiting for unemployment checks.
So the Monadnock Hunger Walk, which normally takes place on one day in May, is instead taking place during April.
It was going to take a month for people to connect around, number one, to get sponsors, and we could not safely walk as a mass, so we wanted to spread that out.
The walk supports a dozen food pantries in the Monadnock region, and there's a form available for those who are interested. Organizers say it's tough to know how much of a difference they're making because they're asking people to send donations directly to the food pantries instead of centrally collecting donations like they have in the past.
We've asked people to put 2020 Hunger Walk or Monadnock Hunger Walk on the memo line so that when all this is over, we'll get a sense of how many people actually participated and contributed.
Usually, the walk is done in a large group. Not possible in these days of social distancing. Instead, take selfies, but make sure you complete your end of the bargain.
Don't wimp out on the walk, folks. Get your sponsors and take a nice day in the sunshine and get a nice picture and show people that, yeah, there was some volunteerism going on during this time.
Ray Brewer, WMUR News 9.
Okay, and there you go on that video and that report. And now let's take a look at that U.S. stock market and see how the U.S. stock market closed for this Tuesday evening. And here's a look at that U.S. stock market for all of you for this Tuesday evening. Your Dow Jones Industrial Average closed in the green, went up. Your Nasdaq closed in the green, went up. S&P 500 closed in the green, went up. Gold closed in the red, went down. Oil closed in the red, went down. U.S. 10-year closed flat. Eurosash USD closed in the green, went up. And VIX closed in the red and went down. Dow rallies more than 500 points on improving virus outlook. Amazon jumps to all-time high. Stocks jumped on Tuesday, resuming the market's sharp rebound from last month's lows as investors grew more optimistic about the coronavirus outlook. Millions of Americans are still struggling to get tested for coronavirus. Let's take a listen to that video from Good Morning America, ABC News.
One of the keys to getting life back to normal. Last night, Vice President Pence announced that the FDA may soon approve a new antibody test that he claims could be produced at the rate of 20 million tests a month. But right now, millions of Americans are just trying to get a simple coronavirus test to find out if they have the disease or not. Matt Gutman has the story.
A nation on edge and millions anxious to get tested. Cars lined up by the hundreds at the Hard Rock Stadium in Florida Monday, reaching capacity by mid-morning. In Paramus, New Jersey, 29-year-old Kayla Codina showing up at her site at 3 a.m. to get a test. She took this photo of herself trying to sleep.
They only have 500 tests available at the site, and they make that very well known that they only have that. So if you don't make it within those 500, you don't get tested.
She did make the cut and 3 days later found out she was negative. But that wasn't the case for California Police Detective Mary Lou Armour. She died from coronavirus complications after being denied a test 3 times.
To think that she could have still been here if they just would have tested her. It's painful.
And with millions still hoping to get tested, focus now also shifting to what could help get Americans back to work. Antibody tests. Antibodies are proteins in the blood that show whether someone has been exposed to the virus. And we were there as the first antibody tests were being rolled out to firefighters in Manhattan Beach, California.
Obviously, what everyone's looking for now with these antibody tests is to see how do we get people back to work. So your golden ticket, as it were, is you're not sick. You've had no symptoms at least for, say, 2 to 3 weeks. You get a serology test and you have positive IgG antibodies, you can go back to work.
But overnight, the World Health Organization acknowledging it simply does not know whether antibodies are the golden ticket. It's one of the reasons the city of Los Angeles is reconsidering so-called immunity passports as it works towards reopening the nation's second largest city.
We'll never get an economy going with just 5 or 10 or even 15% of the workforce. We have to find a way to get everybody back to work. And so that's what we're focused on right now.
So if antibody testing isn't the silver bullet, what is? Well, governors and mayors across the country are saying over the coming weeks, you're going to start to see stores, restaurants, bars reopen. But before you can be admitted in there, you'll have to have your temperature taken. And the other key component is massive and repeated testing for the regular virus countrywide. And one thing, Robin, only 3 million Americans have been tested so far. That's less than 1% of the population.
Okay, and there you go on that video and that report. And that does it for this evening edition of the Riley King Newscast right here on the Riley King Network. Thank you for watching this evening edition. Have a great rest of your Tuesday evening. I'll see you back here tomorrow for another newscast. And I'll have a news report coming up in a little bit. Good night and bye, everyone.